So yes, then he handed the phone and said, "I'm from Governor DeWine's office." I'm like, "Oh my goodness." Yes. It still was yeah, a blessing. Yeah.
So you're a professor at Finley,
Yeah.
teach in business, is that right?
I do. I teach some marketing classes, some operations, and then an occasional leadership class. Yes.
Well, that's great. How long have you been doing that?
I've been there since 2004. And I can honestly say I love my work and I love the students. It's wonderful being in higher education.
Well, that is absolutely great. Any thoughts about, the traditional question, what are you going to do with the money? Anybody, you've thought about that at all?
A little bit. I think it's going to take going to an accountant and probably a financial planner and some other things. Family, some grandkids will have their college fund paid for, and just looking at some things that we have a real passion for in the community as well to help.
Well, that's great. I'm sure the parents of the upcoming college kids were probably almost as pleased as you were last night. So they had to be excited about that. Well, we'll come back to you. The news media will have some questions, I suspect. Okay. And so let's go to Sean down in Cincinnati area. Sean, you're there with your mom, Lena.
Ah, yes. Yeah. Yes. Good morning, everyone.
Good morning. Sean, you just graduated from high school, is that right?
Yep, that is right. Just graduated about a month ago.
And where did you go? Where did you graduate?
I went to Corning High School.
And you're a baseball player, I see. And
yeah, I'm a baseball and hockey player.
And what are you on, a traveling team this summer, or what do you?
Yeah, we're a travel team. We're going all over the states, everywhere, and I have a couple games here next week, and it's exciting to go.
Great. So what position do you play?
I play second, short, and outfield.
And you told me you also, in the past, have played hockey, ice hockey. Is that right?
Yeah. Yeah. I would usually play forward. I've been playing hockey like my whole life, and I just love hockey now.
Well, how'd you get into hockey?
My dad just he signed me up when I was like 5. He was watching like the USA Olympics or something like that, and then he just put me on the ice, and we just went from there, and I got better and better, and here I am.
Well, that's great. That is great. So you and I talked a little bit last night with my wife Fran. You thinking about college? Haven't made any decisions yet? Kind of where are you on that?
I haven't made any decisions yet. I'm uncommitted. I'm glad I am. I'm definitely gonna look at some good schools now that I have this opportunity, and I'm excited to see what I'll come up with.
Well, that's good luck on that. My wife Fran and I and our kids have been through that a number of times. She and I have been through it a number of times with our 8 kids and grandkids who've also been going to college. So it's quite an experience, and a lot of great schools in Ohio. So good luck on your search. So how did you find out last night? Who told you?
I actually got done with baseball, and then my dad actually gave me a call, and I thought it might have been a prank because this did not feel real. And he's like, Governor DeWine called us and everything, and then I called my mom, and she was like all jumping and crying and everything, and so I pulled in to the parking lot, and then I gave you a call, and it just felt real now.
So Lena, what did you think?
I have no words. I'm just so thankful. It's a blessing to have this opportunity for my son. I was praying for that, and just came true.
Well, when you and I and Fran talked last night, I think you were more excited than anyone.
Yes, absolutely. Yes, I've been waiting for this day.
So that is great. So
Thank you.
One other child in the family, is that right? You guys have
Yeah. My daughter, she's 4 years old. She's my beautiful girl. Her name is Camila.
Well, very, very good. Very good. Well, it's exciting. We'll be back with you guys in just a minute. I'm going to say a few things and we'll go and open it up for the press. So thank you very, very much.
Thank you.
Well, today I'm wearing a Cleveland Cavs tie to wish the Cavs luck in another big upcoming drawing, and that is the NBA Draft Lottery, which takes place Tuesday, the day before we announced our final Vax-a-Million winners. The Cavs have certainly, throughout this pandemic, been great community partners, and we thank them very much for that. They've helped promote the COVID-19 vaccine, including ticket deals for those who have been vaccinated and other things. Since 2000, no NBA team has won the NBA Draft Lottery more than the Cavs have. So we wish them luck in hopefully winning the rights to the top pick in the next NBA Draft. So 2 big drawings next week. NBA coming up, that's exciting, and the Ohio Vax-a-Million. We've wrapped up and wrapping up the Wolstein Center, very, very successful. Want to kind of recap that. Approximately 258,000 vaccinations were administered over the 12-week period that the clinic operated at Cleveland State University's Wolstein Center. A lot of people made this happen. I just want to thank all of them. Across the entirety of the clinic, nearly 50% of those vaccinated reported as living in high social vulnerability zip codes. And if you look only at the last 6 weeks of the clinic, that number was 68%. So that was one of the goals. We're very happy about that. Big, big undertaking. Took over 700 people who worked at the site over the course of the operations. We're very grateful to our state partners, our local partners, our federal partners, and certainly including FEMA, who ran the site and helped spread the word about the importance of vaccinations. So again, if you're not vaccinated, while that site is gone, many, many, many sites across the state of Ohio where you can go. A couple other things. As you know, we have basically lifted almost all of the orders in regard to the virus. One of the orders that we are lifting today, actually will go into effect tomorrow, is a state of emergency. State of emergency in Ohio, as I explained when we went into the state of emergency, has very, very limited meaning. In some states it means a lot of different things, but in Ohio it has a very, very narrow meaning. And one of the things, for example, is in regard to procurement and emergencies, that you don't have to go through the normal process. And so it's time for that to end as well. So that will be ending tomorrow. Just, a note to state the obvious, we still are losing people every single day to COVID. And there really is a dichotomy. There's really a fundamental difference between your safety if you're vaccinated and your safety if you're not vaccinated. On the one hand, you're safe. On the other hand, you're not. We have variants that are coming into the state. Things will continue to change. We'll have some more figures next week, but we continue to lose people who are dying every single day in Ohio because of COVID. A lot less than what it was. Hospitalizations are down, cases are down, positivity numbers are down. So we're certainly headed in the right direction. But that is being driven by the people who are vaccinated. And the people who are not vaccinated still run a very, very significant risk. We'll have more specific details as we drill down. The death rate, for example, those report very late, and we're trying to get a kind of an understanding of that, and we'll share some of that with you next week. Again, in regard to the orders, I want to talk a little bit about nursing home visitation as well as visitation in our assisted living. So we have been permitting visitation in our nursing homes, assisted living since the summer of 2020. the summer of 2020 last year. In March of this year, 2021, we required facilities to allow visitation. We are now at the point where the state needs to stand back in regard to visitation. But we really encourage nursing homes to allow for as much visitation as possible. And I'll talk about this in just a little bit more detail. Starting tomorrow, the state regulations describing how visits at nursing homes and assisted living should occur will be removed. For example, visits you will no longer need to schedule visits. Will no longer be a state requirement. Nor will there be a state requirement that you can only have 2 visitors at a time. So we've had few regulations left in regard to visitation in nursing homes. We're basically taking those off. Ohio nursing homes will, of course, need to continue to follow federal guidelines from the CMS. And both nursing homes and assisted living facilities will need to follow CDC guidance. So they'll continue to do that. The only thing that will remain, and I'll get into the one thing that's remaining. But so again, I think there's been a lot of confusion. We've gotten calls. People said we can only visit twice a week. That's not a regulation that we put on. Those nursing homes are making that decision. So we're making it very, very clear that beginning tomorrow, if the nursing home where your loved one has regulations, that is up to that nursing home. That is not something that we are imposing on that nursing home. They'll have to follow whatever federal guidance is. If they're a nursing home, assisted living, they'll have to follow CDC guidance. But as far as what the state is doing, we are encouraging, unless there's an outbreak, we're certainly encouraging visitation. We're encouraging people to have the opportunity to go visit their loved ones. The only thing that will remain is the testing of employees. So we will continue the testing of employees twice a week, but that is only employees who are not vaccinated. If you're an employee in a nursing home and you are vaccinated, the state is not requiring any testing. But if you are not vaccinated in a nursing home and work there, you will continue to have to be tested twice a week. We are doing that because of the unique nature of the nursing home and assisted living. These are congregate care settings. These are people who many times are medically compromised. And we are still seeing new cases in nursing homes. The numbers are dramatically down. We've been able to take them down. We're providing free the testing. We're putting the vaccine in the nursing homes for new people who are arriving. So we're doing absolutely everything we can to keep these numbers down. We're still seeing 80 or so new cases a week in these nursing homes. And by and large, this is being brought in by unvaccinated staff. So that is the challenge. And so we'll continue, for the time being at least, continue to require the vaccination of the not require vaccination, misstated that. We will require the testing of those employees who are not vaccinated. If you're vaccinated, you will not be required to test. Ohio Department of Aging will be hosting a series of webinars starting tomorrow morning to ensure facilities across the state have access to all the information and resources necessary for safe and healthy operations. More information about these webinars can be found on the department's website at aging.ohio.gov. That's aging.ohio.gov. We have sad news from the Ohio Department of Rehabilitation and Corrections. They're mourning the loss of one of their colleagues who has died of COVID. Correction Officer Christopher Jones, who worked at Northeast Ohio Correctional Center in Youngstown, died last Thursday after being diagnosed with COVID-19. He had worked for the prison system for around 2.5 years. ODRC director tells me that he was an avid sports fan. coached youth football for the Austintown Little Colts. His coaching career spanned at least 20 years. His mentoring impacted so many young people. So we mourn his loss. Our prayers go out to the members of his family. Finally, a little bit on data. Eric, if you can put that up on the screen. We've been seeing increasing numbers of people being vaccinated, but obviously we still have a ways to go. So just to share the numbers that are now on the screen, to give you a snapshot, and we'll try to do this once a week so everyone can see it. If you look at the total population of the state of Ohio, total population, we are at 46, almost 47% of that group that is now vaccinated. Now we know that some people are not even eligible to be vaccinated. If you go down and look at 12 and older, it's 54, almost 55%. And if you look at 18 and older, our data shows 57.6%. So the bottom number is what the Biden administration, the federal government is aiming for 70%. They generally are using 18 years of age and older. So our figures would show we're at 57.61% of that age group. We also think, though, it's relevant, 12 and older, what those numbers are, because the information shows that those teenagers can, in fact, spread it. So we think that number is a relevant number as we go forward as well. Our numbers, I think I pointed this out before, our numbers do not include someone who spent the winter in Florida and got vaccinated in Florida, or was in Arizona the winter and got vaccinated, and they're an Ohio resident. They're back here now. We don't include them in that number. So it would be a somewhat higher than that, nor does it include our VA system in Ohio. The VA is, I run into people, every once in a while who tell me they've been vaccinated at the VA. And so the VA is vaccinated a lot of Ohioans. Those numbers are not included in the data that I'm just showing you. So we're ready for questions.
Governor, first question this morning is from Andrew Welsh-Huggins at the Associated Press.
Morning, Andrew.
Hi, Governor. As always, thanks for doing this. We really appreciate it. Governor, what are your thoughts on the House expulsion of Larry Householder yesterday? I know you previously said that he should resign. Was expelling him the appropriate move, and do you believe it was constitutional?
Well, I have said before, as you just pointed out, that I thought he should resign. I've also said that this is a matter for a separate branch of government. Historically, Senate, historically the House, judges its own members and makes those decisions as a separate branch of government. So I respect the decision, but I'm not going to comment beyond that. I've already expressed what I felt. I felt he should have resigned, but this is a decision that was made by the House, and we should respect that decision.
Next question is from Dan DeRose at WOIO in Cleveland.
Good morning, sir.
Morning, Dan.
We're a little upset. Northeast Ohio didn't get a winner this week. First time. I'm not sure if you can fix that, but more on the vaccine numbers. Surely your office has been contacted or had conversations with the White House. President Biden has put a very full court press on that 70%. With the number you just gave us, 57% is nowhere close, and there's no way we're going to get to 70% by the 4th of July. Can you explain any conversations with the White House? Have they said what's going on? Have they offered any solutions?
Well, I think that, as far as what the White House is doing, most of that, maybe all of it is public. So, Dan, I don't know that I can add anything to what you've already seen the White House is saying. We share the goal. We all want to see more people vaccinated. So, we all are on the same team in regard to the sense of we need to get more people vaccinated. I would just again point out that, we continue to see people die every day in Ohio. And I think that, there's a feeling, and Fran and I are traveling around the state quite a bit now, and it's very, very understandable. Everyone is happy summer's here. They're happy that the vaccination is here, and we're going about and living our lives. But there are really two groups of Ohioans. One of those who are vaccinated, and they are very safe. The other is Ohioans who are not vaccinated. And those who are not vaccinated still are running a significant risk. Our numbers are down. They continue to trend down, but we still have the virus in Ohio. And, we're losing. I looked at some numbers today, and the deaths come in late, very late sometimes. I mean, what we reported this week, I think some of those deaths were months ago. And we can't control that. This has what to do with, what coroners are doing and how it's reported. So what I've asked our team to do is to drill down and kind of tell us how many people we're losing now. And, I looked at some preliminary figures, and these are not final figures, and we're going to give you better data next week. But, my quick look at this morning would indicate we're losing 10 people a day still. So, roughly. And so, again, the reporting comes in late. We're doing better than we were. We're losing fewer people. We got fewer people in the hospital. All the things are good, but we still are losing people every day. The virus is still out there. And then when we talk about the variants that, are coming into Ohio that are more contagious, this is a concern. More contagious and dealing with people who are unvaccinated. And if you look at the counties, and we list the counties, everybody can go look at the counties and see what percentage of your county is vaccinated. If your county is down in the low range of vaccination, obviously the odds of it spreading in that county and someone getting it and getting sick are greater than if you're in a county where the vaccination rate is much higher. So those are concerns, that we share. We're going to continue to work to get people vaccinated, make it available to people. We have, some more. You're going to see another ad come on TV about this in the very, very, very near future. And, we're going to continue to do everything we can to make sure that the vaccination is available to people in communities. There's been a great effort by our hospitals, great effort by our health departments who are really, really reaching out, and in some cases literally knocking on doors to do that job and make that available. So this game is not over. We're still in the game. We still got to play the game. We're ahead of the vaccine now, but we got to drive it to the ground, and the only way we do that is with the vaccine.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor.
Hey, Dan.
So I just had a question about the state of emergency. What role does Senate Bill 22 play in your decision to remove that? And also, can you talk a little bit more about what this does? Does it affect your ability to, have the National Guard help out or address outbreaks that may happen, et cetera?
Yeah, we can follow up, Danny, about everything that does, but I've gone through this with my team on numerous occasions in the last several weeks. And we've come to the conclusion that it really does not impact what we are able to do at this point in the pandemic, based on what we have to do at this point in the pandemic. I think sometimes there's a misconception about what state of emergency means in Ohio. It really is very narrow as far as what it does. And from a practical point of view of what we were doing daily early on in the pandemic, mid-time in the pandemic, procurement, purchasing, waiving those rules so that we could get stuff in here now, whether it was PPE or whatever it was, that was really significant. But now we're at a very different stage of the pandemic. And so I think what most people focused on was the mask orders. We've already dealt with that. We've dealt with most other things. This is kind of the last thing to be dealt with. And, look, you ask about the date that the legislature has set and what they did with their legislation. As I've said before, I kind of take the world as I find it and deal with it. And, it's a fact, but it's also, frankly, time. We could not find a really significant reason to continue to do this. And so, we want to announce that tomorrow. I think the visitation at nursing homes is something that will impact people's lives more. And again, I would just say that unless a nursing home has a reason, to be really restricting visitation, and it's up to the nursing home, but we know that people need to be visited. They need to see friends. They need to see family, and it's time. And we've allowed visitation for a long time. We've mandated visitation, in fact, for a while. We've said, how many people could do it at a time. We said it had to be a reservation be made. We're removing those, and so it's just to that nursing home right now, and that's just between the patient and the nursing home, and it's between the family and the nursing home at this point.
Next question is from Jesse Bulmert at the Cincinnati Enquirer.
Hey, Jesse.
Hello. I had another question about the state of emergency. How will this affect the extra food assistance that was provided to Ohioans? We have $125 in emergency allotments in June.
Jesse, you're breaking up. I got to the point of how it will affect, and I can't get the rest of it. So if you could repeat it or.
Yeah, I guess my question was about the emergency food assistance that was provided to Ohioans through the state of emergency.
I don't know. Dan, can you repeat it if you're hearing it?
Yeah, she's asking about any emergency assistance that was related to the state of emergency and if that will be affected by this.
We do not believe it will be, based upon our discussions with the federal government. So we've gone through those. Happy to go through them. Our team offline can with you, but that's a very good question. We looked at that. We wanted to make sure that taking off this emergency did not impact that, and our team is convinced it does not.
Next question is from Talia Naquin at WJW in Cleveland.
Governor, I wanted to ask about the numbers. Since the Vax-a-Million was announced, it looks like about 489,000 people have been vaccinated. Did you have a goal for, aside from getting the most people vaccinated, did you have a goal? Does that exceed what you were hoping for when you announced it?
Yeah, I did not have a number in mind. We know that every person that gets vaccinated, it saves lives and it makes it easier for us to get back to normal. So we know all the reasons why we needed vaccination. I felt that this $1 million, the Vax-a-Million plus the scholarship would incentivize people to get vaccinated. I thought it would also speed it up, that some people who ultimately might have got vaccinated or would have gotten vaccinated would do it earlier. The first 2 weeks were phenomenal. It certainly has leveled off, and but that's pretty much what we would have expected. We would have expected the real impact to come quickly. That first week, big, second week, big, and then tailed off from there. So we got the real impact the first couple of weeks. Now, look, we'll never know. We're still having people sign up, even after last night, after publicity about the fourth drawing. We had more people signed up, and that will continue. We encourage people to get vaccinated. They got one more shot, one more opportunity. Get vaccinated. Sign up by midnight Sunday night. So it continues to impact people, we're sure, but it's frankly hard to quantify. But yes, I'm happy, very, very happy with the way it's turned out.
Next question is from Sarah Arthurs at the Findlay Courier.
Yes, thank you. My question is for Suzanne. Hancock County has been lagging to some extent the state average in terms of the percentage of people getting vaccinated. I'm curious why it was important to you to get vaccinated and what conversations you've maybe had with friends in Findlay, Hancock County about the importance of being vaccinated.
I did not have any hesitation when my age group came up to get vaccinated. I think it was for the best thing to save lives, to just kind of get our economy back. And I would encourage anybody to get vaccinated in the area. I just think it's a smart thing to do from a health perspective.
Let me maybe take this chance also to give Sean and his mom, Lena, an opportunity. Did you guys have any hesitancy about getting vaccinated, and might share anything about that thought process with us?
Oh, absolutely. I always knew it was the best for everyone. And I encouraged my son to do it, and just for the safety of our community, everyone.
Okay. Thank you.
You're welcome.
Next question is from Andy Chow at Ohio Public Radio and Television.
Andy.
Hey, Governor. I wanted to ask you a budget question. It looks like the state might be getting more money in its budget than it originally projected. How do you see that impacting the budget process? What do you want to see? Where do you want to see that money go? Where do you not want to see that money go?
Well, I've had private discussions with the Speaker and the Senate President. They can obviously speak for themselves. But your question is to me, and let me just say that, you know, we were very conservative when this pandemic hit, fiscally conservative. We cut back on spending. We froze hiring of new employees. I think it was clearly the right thing to do. I think that we must look at this money as one-time money. When our budget director, Kim Mernix, gave us the numbers, this is additional money, but we believe it's one-time money. This has been a very, very unusual period of time. The federal government has pumped more money into Ohio's economy and every other state's economy than has ever been done before that I'm aware of. I'm not aware of any period of time when the federal government has pumped that much money into the economy in such a short period of time. So that is a one-time occurrence. We are seeing an increase, for example, in revenue on sales tax. People are getting the money, they are going out and spending it. People have not been able to spend it for a while. So this big increase that we're seeing has to be looked at as one-time money. And therefore, we need to be very conservative with it. We need to be very careful with it. We don't have to spend it all. We do not have to spend it all. This has been I don't have to tell anyone who's watching this that this has been a once in a lifetime or once in 100-year upheaval in not just in the economy, but in people's lives. I don't think we know how this story really plays out, particularly from an economic point of view, jobs point of view. There is a concern that I have about inflation. We're pumping a lot of money in. The federal government pumped a lot of money in. And what is this going to do with inflation? What does this do with the cost of goods? What does this do with the cost of delivering services in the future? So when we look at this, quote, extra money, this extra $3 billion, I think we have to be very, very conservative in how we spend it. In fact, not spend a lot of it, and maybe not even spend the lion's share of it. In addition to that, the money that we do spend, I think we need to look at the long-term needs of communities, the long-term needs of providing infrastructure in the state of Ohio. So taking that money and putting it into what will be a cost in the future, cost that we know we're going to have, I think is very, very important. Look at our, we've done a phenomenal job in bringing back our state parks, for example, a place where so many people go to camp, so many people go to stay in cabins. We've done a good job moving it back up, but we still have a ways to go. We still have, we're still behind, and we've got to get caught up. And investing there and in other places, H2 Ohio, for example. These are all possibilities of where we know we're going to need to spend money in the future. And if we could spend some of that money now, when we have, inflation's lower, and it really is an investment. So I believe in taking this, quote, extra money, which is one-time money and must be looked at as one-time money, and investing it, either hold on to it, kind of bank it, so to speak, or putting into things that we know we're going to have to spend money on in the future, getting it maybe at a lower cost today, and building our infrastructure back up. It goes really to the quality of life. It goes to being prudent about how we spend this money. So those are just some ideas, my personal ideas. Don't speak for the legislature. Legislature has to act. This is something we all have to work on together, and we are working on it. But those are just some thoughts about this extra money. It's a good problem to have, but we have to be responsible about it.
Next question is from Laura Hancock at cleveland.com.
Hey, Laura.
Hello, congratulations to the winners. I just had a kind of a question, Suzanne, on your Finley faculty profile. It says Chris. Is that like a nickname or? And then I was also wondering, Governor, do you know how many nursing home staff percentage-wise are vaccinated, or how many are not? Any kind of numbers like that? And then for both of the winners, I was wondering if you could talk a little bit about if you have had COVID, if you know anybody who got sick with it, anything like that. Thanks.
Okay, I'll take it. I'll take the first one. We'll get you good numbers in regard to the percentage of staff that's been vaccinated. I think it is somewhere in the area of 55%, but it really varies. Some nursing homes it's very high. Some nursing homes it's very low. But we'll try to get you the best numbers. I know that the federal government is now requiring reporting, so those numbers should get better. But we'll give you later today, as soon as we can put them together, the best numbers we can that we have available, and we'll make that public for everyone. So maybe we'll start with you, Suzanne, in regard to questions that Laura had.
Yes, Laura, my full name is Suzanne Christine. So yes, I go by Chris, but driver's license, other things are labeled as Suzanne. And I don't remember your other question.
Just if you have COVID or anyone close to you, any experiences with the virus?
I did not have COVID. I think the university and a lot of the measures put in place were very helpful for that. But I do have one good friend that got COVID and has long-term COVID, and then other people that I know, either friends or colleagues that got COVID as well. So actually I know two people that have long-term COVID, and they were, one in particular was a very healthy individual. And so I think this virus was to be taken serious.
Sean and Lena, you want to answer the question in regard to, do you have anybody in your family who've had COVID, or anybody you know, any experience with it?
Absolutely. I actually had COVID during Thanksgiving. My sense of smell, taste, everything was gone. That was very frustrating for me. Symptoms of headache and just overall, it was very bad. but I was so anxious just to wait for that vaccine on my age group. I'm just very thankful that we have vaccines. So just.
Great. Thank you.
You're welcome.
Next question is from Raven Richard at WCPO in Cincinnati.
Hi, good morning. First things first, congratulations, Sean. We are all so happy for you. Yay, got somebody from Cincinnati. So now, Governor, I want to ask, so the lottery is ending next week. Do you guys have any plans for maybe more incentives after that, or more plans to get more people vaccinated? And also, I don't know if you guys have crunched the numbers, but is there a certain projection when you think we'll hit our goal?
We're going to have some announcements after the vaccination. The last Vax-a-Million winners announced at some point. Not saying what day, but we'll have some different incentives. We also will be talking in regard to long-term goals in regard to how we're going to work with young people going back to school. We also, next week, will report to you in regard to exactly what we're doing with summer school, what we're doing in regard to boys club, girls clubs, basically the summer plan that's now already being carried out as far as vaccinations. So we will have more to talk about in the future. We think we'll get through the Vax-a-Million, complete that next week, and then after that, at some point, we'll announce some different things that we will be doing. The main point, I guess, is that we're not done. We have to continue to work very, very hard because what our school year is going to look like beginning in August, what our winter is going to look like will be determined by a great extent by how many people are vaccinated. So we've done well. I showed the numbers up here, but we have a ways to go, and we're not done yet.
Thank you. Thank you.
Next question is from Luis Gill at Ohio Latino TV.
Good morning, Governor.
Morning.
Morning. Thank you for having this. And congratulations to Raven. That's the question I had, so she had a great question. Governor, my question is, do you have any idea on statistics of once this coronavirus is, behind us and, dependence on the time, I know we're talking years, but do you have an idea once it's leveled off, will it be treated like a regular illness? It will be with us, for the rest of our life. The 100 years ago, it lasted a few years, but then, people forgot about it until right now that we're, this is occurring again in a different faction.
I'm not the medical expert. Dr. Vanderhoff is not on here. So that might be something that we can have Dr. Vanderhoff address with you in the next several days. The one thing that we've learned about this virus is it's tricky and it's hard to predict. And just when we think we've maybe have got it figured out and it's predictable, then we find out it's not. So I think it's, we have to simply be cautious. We have to get as many people vaccinated as we can. We know the variant is out there. Different variants are out there. We know these variants are more contagious than we have seen in the past. So, this will continue to evolve. I don't think anyone can predict where we will be in the fall, where we'll be in the winter. I'm optimistic, but no one really knows. What I think we do know, and I'm trying to stick with what I know, and that is the more people we get vaccinated, the better shot that we have, opportunity that we have moving forward.
Next question is from Molly Koweek at WHIO in Dayton.
Hi, Governor. We know that throughout this entire pandemic that vaccination rates in minority communities have lagged. What is the state's strategy moving forward to increase those vaccination rates?
Yeah, it's been a high priority for the state. It's been a high priority for the 113 local health departments. It's been a high priority for everyone, our hospitals, our physicians' offices. So, we continue to work in this area on two different levels. One is availability. We never can do enough. We never can do enough to make the vaccine available, easily accessible to people. And so we continue to work on that. We also have an ad coming out that is aimed at the general population, but it is also aimed at our African-American people of color population as well. So we continue to work on these levels. In the future, you're going to see us continue to try to address for everyone concerns that people have and try to answer those from a scientific point of view. So, we have people who are not getting vaccinated. We have to make sure that it's available to them. That is what we have to start with. But we also have to work to address with people who are experts, people who are scientists, people who are experts in medicine about some of the concerns that are expressed out there on the internet. So we will continue to do that. And next week, when we talk about where we're going during the summer, what we're doing already in the summer, where we kind of preview of what we're looking forward to do in the fall, we will specifically also talk about what we're doing in regard to people of color to make sure that, we can do everything that we can to get those numbers up as well.
Governor, next question is the last question for today, and it belongs to Jess Harden of MahoningMatters.com.
Hi, Governor. Thanks for taking our questions today. So I have another budget question. The bill includes language that provides a process for the 3 school districts under state takeover academic distress commissions to regain local control. And I was wondering, what your thoughts are about the process outlined in that bill, and if you support that provision.
Yeah, I know that there is that in there, but I have not looked at the language, nor have we analyzed the language. I'll restate my basic principles without commenting on that language, because as I said, I've not looked at it. I understand the great desire of communities through their elected school board to be able to control their own schools. That's a basic principle in Ohio that's very, very, very ingrained and very important. We also have a principle that we cannot abandon, and I refuse to abandon any children. We need to make sure that the state is doing what it needs to do so that every child has the opportunity to learn and to grow. So I'll look at that. We'll see what the House and Senate end up with when they come out of conference committee. But I'll be talking about that in the future. So I really can't give you any specific answer at this point, simply because I have not looked at the language. So thank you, everybody. Hope everybody has a good day and a good weekend. Thank you.